Well, the weather is cooling, but it's still mosquito season. And with those bites come the possibility of disease.
In this week's California Health, 23 ABC's Scott Sheehan spoke with county mosquito experts about how they're trying to limit those bites. Scott?
Mike, Danielle, officials at the Kern County Department of Public Health say West Nile virus is the most common mosquito-transmitted disease in Kern County. Last week, health officials confirmed that the number of West Nile cases here in Kern County is up to 10 in people and 1 in a horse. And limiting mosquitoes can limit the spread of this disease.
Kevin Striff is an area foreman for Kern Mosquito and Vector Control. His coworker Terry Knight says their job is to limit the spread and bite of mosquitoes in Kern County. At Hagen Oaks, they're trying to spray to kill mosquito larvae before they reach the adult phase and start reproducing.
The number of eggs each female can lay is between 250 to 350 eggs. That's per deposit, and she can lay eggs multiple times.
Not only can mosquitoes be annoying when they bite, but they can also spread disease. For the last 15 years, there's been one virus of particular concern.
Here in Kern County, since 2004, West Nile virus has been a major concern.
This year, Kern County Department of Public Health has confirmed 11 cases of West Nile virus, 10 in people and 1 in a horse. And Knight is expecting that number to double.
It looks like we're on track for 20 to 25 humans once again here in 2019.
Kimberly Hernandez is a public health assistant director of health services. She says while the normal West Nile virus season is April to October, there's still concern for the rest of 2019.
You know, there are some years where we have West Nile virus activity that goes through December. So it just depends on the year, and it's awfully hard to predict, unfortunately. A lot of it is just watching of how many mosquitoes we have out there.
Hernandez says in most cases, someone doesn't know that they have West Nile virus. However, in 20% of cases, the person can experience a terrible headache and rash, while in more extreme cases,
a very small proportion of people can develop symptoms that include things like meningitis and encephalitis. And so those are very rare, but they are very severe cases that do happen. And an even smaller proportion, it's very rare, but West Nile virus can be fatal.
Knight says how many mosquitoes and cases of West Nile virus in Kern County is based on a couple of things: what the weather is like, how much area his sprayers can treat, and if homeowners are doing their part.
If you have standing water on your property, dump that water. If you remove that water, then you've removed any possibility for a mosquito to breed in your front or backyard. Not only are you helping yourself, you're helping your community.
Hernandez says mosquitoes only need a tablespoon of water to lay their eggs in. While Knight points out, if you're not going to use or treat your pool during the off-season, to drain the water.
Water's green and it has a bacterial culture in it. That female mosquito probably will lay eggs on the surface of the water if she's ready. A blue or chlorinated and clean pool is not the case.
Knight and Hernandez say it's important for everyone to do their part to limit mosquitoes from breeding and biting us.
It only takes the bite of one infected mosquito to infect you with West Nile virus and possibly make you ill.
A couple of tips from Knight and Hernandez to lessen your chance of getting bit is most mosquitoes are out during dawn and dusk, so wear long sleeves and pants during those hours, as well as wearing bug spray with DEET in it. Finally, if you do experience a terrible headache with a rash after a bite, seek medical attention. For California Health, Scott Sheehan, 23 ABC, connecting you.